This podcast is made possible in part by WKTV Community Media.
Welcome to the Be Nice podcast, where we dive into conversations that help us to recognize, understand, and take action when it comes to mental health and suicide prevention. I'm Christy Buck, your host. The Be Nice action plan is simple. Notice, invite, challenge, and empower. 4 steps that can change lives. Together, we'll share real-life stories, insights, tools to break down the stigma around mental health and inspire positive changes in our communities. Our guest for this episode is my good friend and coworker, Kat Lanting. I'm going to break down some stigma before I hop into my conversation with Kat, and this is something that we're extremely passionate about. She could break down the stigma too, but I'll start with one of the biggest myths. A parent's mental health struggles don't really impact their kids. In reality, children are deeply impacted by the emotional environment at home, even when nothing is openly discussed. About 1 in 7 children in the United States live with a parent experiencing a mental health condition every year. Mental health challenges in a caregiver are also recognized as an adverse childhood experience, also known as an ACE, which we know can shape long-term health and development. Research shows children in these environments may have 2 to 4 times higher risk of developing mental health challenges later in their life. But this is important. That's risk, not a person's destiny. So we're going to open conversations between Kat and myself, who both experienced living in a home where a parent was experiencing mental health challenges. I hope you will gain a lot of knowledge from this and enough knowledge to know that opening up conversations in your own home will be breaking the stigma. So, today, my coworker and good friend, Kat Lanting, is the Director of Programming and Expansion of the Mental Health Foundation of West Michigan. She leads strategic growth and accessibility of mental health education programs and remains actively involved in delivering trainings, including Mental Health First Aid and Be Nice. This programming both serves and goes out to adults and young kids, adolescents, teens. She's passionate about equipping communities with practical, evidence-based, informed mental health tools and belief that small actions can make a meaningful difference. That's a lot, isn't it, Kat? Kat, here we go with the meat and the potatoes. Is a Grand Rapids native. Left for a bit and came back, right? We almost lost her to Texas for a moment. And she is a Michigan State University graduate.
Go green.
Go white. She is especially committed to helping young people access the kind of mental health education she wishes would have been available when she was in high school. She lives along the lakeshore, and I know that one of her protective factors are her family, dogs, and sailing. Anyway, Kat, will you start with just a little bit of your background and bringing us to the point where how you got involved and where your passion really turned it even more passion, getting involved with Be Nice.
Well, it's super exciting to take a deep breath and think about it, right? So I've been in this role for 13 years while working with the Mental Health Foundation, but in the role of talking to other people about mental health and suicide prevention. And if you would have asked me that early on, is that going to be the path? You know, you never think that, right? So I do remember my first passion for talking to people about really difficult things was in college. And I got a internship/job, kind of really fun experience with the Olin Health Center at Michigan State. And you could decide if you wanted to go into nutrition. And there were a lot of nutritionists going that way, people in that major, right? They wanted to talk about health in that way of nutrition, how to keep your body healthy. It was a group of a bunch of young people who came to this position of we want to promote health. And that was one choice. The other choice was sexual health advocacy for Olin Health Center.
Sure.
So at that time, a lot of student groups had to go through 30 minutes of both of these classes, right? So like all of the Greek life had to go through this class. I wasn't if you would have asked me before that, are you prepared to have this conversation? I probably wouldn't have said yes, but we dive in and all of a sudden we're advocating for health in a way where you have information that maybe the layperson doesn't. So they were difficult conversations. It was kind of funny to my roommates and my friends, but I took it super seriously, and I really loved it. And then I got a job at Willow Teen Health Center. So we were going into Lansing area schools, talking about hygiene, health, kind of social media safety, but that was way back when not a lot of young people had social media in their phones, but they were definitely going on like chat rooms, right? So that was really fun. And it was also a moment of understanding when you're closer to that individual, whether it's in demographics of age, you can speak their language, those individuals will listen, and that's a really important topic, whatever you're talking about. So that's where I really learned opening up the conversation was key. And then I kind of walked into the Mental Health Foundation, as you know, with a friend that was working there, and quickly found my space of, wow, this is something that hits super close to home. So every time I was in that classroom, I was learning way more than I think some of the kids in the classroom were about myself, about what was going on with me when I was in that seat. So I really learned quickly, you know, after taking some abnormal psych classes and learning about health education was part of my major in college. But the thing that spoke to me most was if you have a platform to talk to a young person about something they want to talk about, as you're opening up the door, you've got the facts maybe, but the listening piece is the biggest piece. And to have them guide the conversation and the excitement of even when I would see adults that were in the room as well saying, wow, thank you so much. You know, I'm sure you've had that feeling too of, well, you can do it too. It's super simple. Just make it okay to talk about whatever the topic is.
I totally agree. And I think that, you know, I went that route of recreational therapy was my major, and my internship was at a psychiatric hospital, St. Lawrence, right, inpatient. And I had to work Friday nights, Saturdays, and Sundays. And it would be at a time where we would get a lot of inpatient on that. And it was the closed unit. And I learned a lot. I mean, I did. I, you know, was a senior at Michigan State, didn't know what I wanted to do after. I just had to get this internship over with. And then it wasn't until, I'll be honest with you, probably 12 years into my career of working with the population that I finally, by gaining an understanding by presenting, talking about it, made me really realize what my life growing up was. And that was learning about my own family, learning more about my mom, learning more about things that didn't get talked about at home, right? And I was out educating about reducing stigma, and yet it was all, I grew up in a stigma-filled environment. You also have some experience in childhood and living with, you know, parents, family members that have mental health challenges at some point in their life. Reflect back on that a little bit, best you can.
Well, just like you know, you're teaching what's on the slide that says, here are some risk factors, right? And then you're realizing kind of as you go, it can be on the slide as much as you want, but until you hear that real life story. And that's where I really felt a connection with audiences, because we do an activity where we go around and ask everybody, what's your first memory of mental health? So when you come up with, you have to start that conversation and share maybe your own story. And the more you share, the more comfortable you are, because it helps other people open up. So those stories began, I was reflecting on, I have a really large extended family. So I kind of think of it as like a statistical subset, right? So you can see a 10 sibling, and then there's 42 first cousins. That's the generation I'm in. And whether it's diagnosed or undiagnosed, there is depression and substance use disorder in that family. And really understanding that and looking at, and then, you know, going through research and learning about genetic illnesses, and like you were talking about ACEs, it's really important for us to have the conversation of, hey, this doesn't have to continue, right? And be consistent. So I think it's really interesting when you share stories, even within families and small communities, because we can be in large groups. There's been so many times where we're in a really large group and somebody's sharing something very intense that they probably never have talked to their parents about, right? I've talked way more openly about my journey with having a parent with substance use disorder and depression with strangers than with my parents, right? Even though we've gotten better at opening up that conversation and moving through it, I think it can be really helpful for that individual themselves sharing the story to say, okay, yeah, I'm analyzing this, right? This is how my brain was made. These are my family members. So obviously I have these signs and symptoms and risk factors. So I think that is some piece of advice that I would give an individual who's in a situation where they have a loved one, whether it's themselves, somebody else, sharing that story and talking to others in whatever type of support group and community that you can find can be very healing. And also interesting, right? Like, yeah, this is a risk factor of mine, but does it have to affect me every day? No.
It's not our destiny.
Right.
Exactly.
Yeah.
And it doesn't mean that you will be affected yourself. And that's why I think the work that we're doing right now is so important to allowing young kids, typically we're 7th, 8th high school students, knowing that if you have a risk factor of genetic predisposition, right, it's time to see within yourself that self-awareness piece.
Right.
And I didn't have that necessarily, and I know that until much later, and I looked back. So history came, my mom struggled, she got quite sick, quite ill, spent a lot of time in psychiatric facilities for a few years. And then it wasn't until I was a junior and I didn't see it until, I was an adult in my 30s looking back.
I
doing all these
remember
presentations.
some of the first times you were sharing stories about your mom. I mean, it wasn't, when I started, it wasn't the only story, right?
Right.
They were a lot different. And then you've opened up about different family members too. But yeah, you just sort of see that evolution of, okay, I think this audience needs this now.
And you are processing it in your own head, like, whoa, that junior year, that semester, I was not well. And I got to go back. And then I looked, wow, my sister was my protective factor.
Yeah.
Man, I was so fortunate that she was home doing student teaching in town, I'd find myself on the Greyhound bus. Remember the Hound? I'd find myself going out for happy hour on a Friday and walking out to the bus station and jumping on the bus and just showing up at home. And my mom would be, what'd you come home for? I just needed to be home. And I was then discovering so much about what had really been an ace. I mean, it really was coming to terms with it. I wasn't in counseling. I wasn't on medication for this, but I was unraveling some really heavy duty stuff. I was really your whole story. And then the thing that I love also is how at the foundation, we all get to know each other's parents too. And I think that that's such a big part of who we are. Share just the importance of those relationships also, and how as an adult now, that relationship has become even stronger.
Yeah. With my parents.
Yeah.
Yeah. So my parents are in their late 70s, and they've gone through a bunch of different types of health journeys in the past. But as you become the adult of children, or of adults that are just people, that's a really interesting transition. And that doesn't happen, late in life. It just keeps evolving. But when I do look back at those times, like one you were describing, one for me would be I would come home and not know what that was going to look like. I knew my mom was still going to be at work, and I didn't know what was going to be happening. Was my dad going to be locked in his room, and I would knock at the door and he wouldn't come to the door? Would he have been using alcohol that day? Would he just be gone? I didn't know. So yeah, it's just really interesting to process now that I have to go into every situation with individuals in my life and say, okay, what happened in the past, I still want this person to be here. I'll never forget, I'm digressing a little bit, but my partner, Brian, a really hard thing happened with my dad, who still struggles with substance use disorder and luckily is on a new medication that's helping a lot. But I was with a really good friend that came on a trip, and he had been using, and I call it like using, and sometimes I get a little cringy, but alcohol is a drug that an individual will use that will change how they think, act, feel, how they live, laugh, love, everything about how they interact with everyone else, right? And I know he didn't choose to do this. This is his illness, but it was just a really hard weekend. It was probably like 5-6 years ago.
Yeah.
And I was embarrassed because my friend was there. And and my friends now know, my really good, tight friends, and I think this is important too, is you let your community know what people struggle with too. Because if my dad had cancer, which my mom has had breast cancer, I tell my friends. So when your parents are struggling, you tell your friends and you bring them in and you say, these might be their triggers. Back in high school, it was cool that my dad drank. It was awesome. Everybody loved him. He was the life of the party because he was not, an angry drunk or whatever. He would just be silly, and people loved it. And people would be like, yeah, let's hang out with Kat's dad. And I didn't create that boundary. I didn't know how to. And I wish I would have had that support of being able to be maybe in therapy, maybe have a mental health professional help me with those tools of, okay, this is going on with this individual. It's not my fault. Here's what substance use disorder is. I just didn't even know. Yeah. And I was really embarrassed. So anyways, this thing happens, and my partner, Brian, I come home and I say, I have to have this conversation that I don't want to be with this person if they're using. Meaning my dad. So he said to me, you can tell him that you're not going to hang out with him anymore, but then you're not going to see him, right? So he had not been engaging in treatment, and it just hadn't been a step that had been taken yet, right? And he's older in age, and it's just a whole journey. I can teach mental health first aid and the Be Nice action plan every day, right? Yeah. And it's still up to an individual to seek out treatment themselves. So that's a really important thing to remember. So that was incredible, that statement of, okay, well, you can say that, but just be prepared that you're not going to hang out with that person. And listen, I am not a mental health clinician. So anybody listening, you have to make your own choices and set your own boundaries with individuals. But I think that every single time that I interact with this person, because of those experiences when I was younger, and when you say ACE, it's like you can see it up on a slide, adverse childhood experience. But when your brain is that young, and when you tell the story, I feel it come out too, I'm right back in that space. Yeah. Right? And that's what's so important about our program, is that a young person can hear that other people are going through that. I went to Forest Hills, which was basically a bubble of what I thought everybody was perfect, right? No one else had the home life that I had, according to myself at that age, right? Yeah. It was definitely happening, but there was not the space for me to recognize that, to learn about it, to understand it. So for someone else to learn that was going on at my house would have been really embarrassing for me. I was trying my best to fit in, right? So I think that's the importance, is being able to recognize earlier on, because 20s, 30s is too late. Yeah. That's too much time to go on this roller coaster. And I'm really happy that I have the relationship with my parents now that I do. Like I said, every interaction, every day, every week is going to be different, and it's going to be what we want it to be and how we can, it's not always going to be perfect, but I think it's important to know too that I can use that action plan for myself and understand, okay, I'm going to go home and I'm going to take a break. And what's the next good and right thing I want with this person, right? So maybe, I text my dad a song. He's very into music, and that's how we connect. So we were actually painting his boat yesterday, and we were listening to John Prine. That's one of his protective factors. So yeah, it's a long journey, but what's very interesting to me is those early years And I see that with a bunch of my family members too, and their parents of that early interaction can be key. And I'm excited to see young people, like even my stepdaughters, having conversations with their dad. He's very open about his mother's journey with mental illness and hospitalization and his own journey with depression. And it's just really beautiful to say, like, yeah. And I remember telling my stepdaughter one time, she's like, I don't want to end up like that after her dad had a bad day. And I said, you're not him. You are pieces of so many different people. You're pieces of so many different experiences. And you recognize that piece about your dad is really, really tough. But again, not your destiny. So
recognize,
really cool.
Understand, and take action. Right?
Yes. Notice.
And we talk about it all the time. And it's just been such an amazing journey of how our program has just grown so much, and you're a huge part of that, Kat. What are your, here we are, we're coworkers. What are your hopes and dreams for Be Nice?
Oh, wow. We research different programs a lot. We have this really awesome new coworker who's very into, I know you've seen her emails, Claire, and she's, have you seen this? Have you seen that? And sometimes we say, oh, wow, this program has so much more funding and they're going farther. But every time I look at something, it seems complicated. And it seems like something somebody would have to sit down and learn very deeply either. And all those things are important. I think anybody doing a program to teach someone how to be more well is great, right?
Yeah.
But I hope that Be Nice can be accessed and accessible to more spaces that just need a simple plan. Like I'm thinking, I know that we're not all the way throughout Michigan, but I'm thinking like a rural community that doesn't have a lot of access to resources, but that uncle learns this action plan and talks to his nephew about maybe what he went through when he was younger and maybe his, genetic path and his ACEs. And he says, I'm starting to see some of those changes in you, my nephew. Yeah. I love you. Let's talk about it. And that's it. That's my hope.
Absolutely.
Learns a simple tool and uses it.
I love it. Mm-hmm. And we heard news that the suicide rate amongst youth has decreased.
Exciting.
And we will take credit for part of that. And that is in that challenge step where we challenge people to utilize the crisis hotline 988, text line also 988. Let's go for it and get that information and not be afraid to talk about it.
Absolutely.
I'm excited that you're part of my hopes and dreams, and that is to extend out to more folks all over. For me, it's that national, right?
Yeah.
Let's get to the heart of Texas.
I'm looking at the
Let's
map
get to the
right
panhandle. Let's go, right? But we can't do it unless we have folks like you today listening to this podcast. Thank you for listening to today's podcast. And I hope you learned more about stigma and myths and facts about what we're talking about. Most of all, I hope that you've learned more about the Be Nice action plan. Notice, invite, challenge, and empower. And that not to be embarrassed and ashamed to reach out and talk about maybe your own stories that you may have about mental health. You never know if that might change, save, and improve someone's life. If today's episode resonated with you, please share it. This is the only way we're going to be able to spread this message further, is with your help. Don't forget, if you know of someone who is struggling or you yourself is struggling, help is always there 24/7. 988, text, phone, whatever, seek out those resources. While they're making a difference, also you can be taking the pledge at benice.org. For now, I'm signing off. Thank you very much. Be nice.
This podcast is made possible in part by WKTV Community Media.